So for the next discussion which we'll be having, we'll be talking about the deep palmar branch. Okay, so it's basically a branch that gets to form what? The deep palmar arch. Okay, so what is a deep palmar branch? If you want to actually discuss this, it's actually small, but it's a very important artery, and it connects the superficial and the deep arterial systems of the hand. So usually what arises from the radial artery, and it helps to complete the deep palmar arch. Okay, so what is it? Arises from the radial artery after it passes through the anatomical snub box, then enters the palm. Okay, you understand? So deep palmar arch, deep palmar branch. Okay, so sometimes it's described as the deep palmar branch of the ulnar artery when referring to its contribution to the deep palmar arch. Okay, but just by the way, okay, it's typically from the radial artery. So it passes what medially across the palm, joins with the deep branches of the ulnar artery to form the deep palmar arch. Okay, it lies close to the base of the metacarpal bones and the interosseous muscles. So connections: the deep palmar arch, it forms mainly by the radial artery, completed by the deep palmar branch of the ulnar artery. So it gives rise to the palmar metacarpal arteries. So it supplies the deep structures of the palm, like the interossei, the lumbricals, the adductor pollicis. Okay, it supplies the metacarpal bones and the joints. It also contributes indirectly to the digital circulation. Okay, all of that. So learn about it simply because we want to know about the collateral circulations, want to know about the surgical relevance, and also the variations that could occur there.